Have you ever wondered if we're labeling too many teenagers as mentally ill? Every time you scroll through social media, it seems like everyone has anxiety, depression, ADHD, or something else. More teens are being diagnosed than ever before. But here's the question: are we finally recognizing their struggles? Or are we overdiagnosing mental illness in young people? Let's talk about it. The mental health crisis is real first. Let's be clear. There is no question that teens today are struggling. Rates of anxiety, depression, self-harm, and suicidal thoughts have gone up significantly, especially since the pandemic. Social media, academic pressure, climate anxiety, family stress, identity confusion. It's a lot. So when more teens are being diagnosed, it's not because they're weaker or softer than previous generations. It's because they're living in a world that's louder, faster, more connected, and more overwhelming. Getting help, getting a diagnosis, getting support, that's not a bad thing. In fact, it's often life-saving. But here's where things get complicated. The line between emotion and illness. Teenagers go through intense emotional changes, mood swings, identity shifts, rebellion, confusion. It's part of growing up. It's normal. The challenge is this: where do we draw the line between emotional development and mental illness? For example, a 15-year-old feels sad for 2 weeks after a breakup. Is that depression? A teen zones out in class and forgets homework. Is that ADHD? A shy, introverted kid avoids parties. Is that social anxiety? Sometimes yes, sometimes no, sometimes it's a gray area. The problem with overdiagnosis. Overdiagnosis doesn't mean the teen is making it up. It means we might be rushing to label behaviors that could be part of normal development. And that matters for a few reasons. Labels stick. Once a teenager is diagnosed, that label can follow them through school, college, and life. It can shape how teachers, friends, and even they themselves see their identity. Medication isn't always the answer. Medication can be incredibly helpful. But if the diagnosis is wrong or rushed, the medication might not help, and it could even cause harm or side effects. It can overshadow the real issues. Sometimes a teen's behavior is due to trauma, family stress, bullying, or social isolation, not a mental disorder. A label can sometimes mask the deeper cause. It reduces room for growth. If a teen is told, "You have anxiety," they might stop challenging themselves, even when they're capable of managing those feelings over time with support. Why overdiagnosis happens. So why is this happening more often now? There are several reasons. 1. Increased awareness. People are talking about mental health more, and that's a good thing. But it also means that normal emotions are sometimes pathologized. Feeling nervous before a test doesn't always mean you have an anxiety disorder. Not wanting to get out of bed one weekend doesn't automatically mean depression. But we see a few symptoms online, relate to them, and suddenly think, I must have this. 2. Social media self-diagnosis. TikTok and Instagram are full of mental health content. Sometimes it's helpful, sometimes not so much. Many teens watch short videos describing symptoms like, if you do this, you have ADHD. This one behavior means you have trauma. If you're overthinking, you have anxiety. These videos often oversimplify complex conditions, and teens who are still forming their identity might latch onto those labels too quickly. 3. Pressure on schools and parents. Teachers and parents want to help, but sometimes they push for evaluations too fast. A student who struggles with concentration might just be bored, tired, or dealing with personal issues. But schools under pressure to improve grades might suggest assessments or interventions prematurely. Parents too might be overwhelmed, and hoping a diagnosis leads to faster support, which is understandable. 4. The diagnostic system itself. Mental health diagnoses rely on checklists. The DSM, the manual used for diagnosing, outlines symptoms and criteria, but these checklists aren't perfect. Many symptoms overlap. Trouble sleeping could be depression, anxiety, trauma, or just teenage stress. Irritability could be hormones or something deeper. So even professionals can struggle with precision, especially if they only have a short appointment window. The risk of underdiagnosis. Now, let's be fair. Overdiagnosis gets a lot of attention, but underdiagnosis is also a serious problem. There are still many teens suffering silently, afraid to speak up, or being dismissed as dramatic, lazy, or attention-seeking. So the goal isn't to stop diagnosing, it's to diagnose wisely, to listen carefully, to ask deeper questions, to look at the whole person, not just their symptoms. What should parents and teens do? If you're a teen or a parent concerned about mental health, here's some advice. 1. Don't panic over labels. Getting a diagnosis doesn't define you, and not getting one doesn't mean your struggles aren't real. Focus on understanding what's going on, not just the label attached to it. 2. Seek a qualified professional. Avoid self-diagnosis through social media. A trained psychologist or psychiatrist will take time to assess the full picture, not just one or two traits. 3. Ask about alternatives. If a diagnosis is given, ask, could there be another explanation? What other options are on the table besides medication? Are there lifestyle, school, or family factors contributing? 4. Focus on skills, not just symptoms. Whether or not a teen has an official diagnosis, therapy can help build emotional regulation, social skills, resilience, and self-awareness. That's what matters most in the long run. The balanced approach. The answer isn't to stop diagnosing teens. The answer is to diagnose thoughtfully. Some teens truly benefit from early intervention, but others need space to grow, feel, and make mistakes without being told their personality is a problem. We need to normalize the full range of human emotion, to teach teens how to cope with sadness, frustration, loneliness, without assuming something is wrong with them. We need a system that supports teens without over-labeling them, one that asks not just what's wrong with you, but also what happened to you, what do you need, how can we help? Final thoughts. So, are we overdiagnosing mental illness in teens? In some cases, yes. In others, we're finally listening. It's not black and white. Mental health is real. Diagnoses can help. But they must be given with care, clarity, and context. Teenagers are growing, learning, changing. They need guidance, not just labels. Support, not stigma. So, let's keep the conversation going with compassion, honesty, and open minds. Because every teen deserves to feel seen, heard, and understood, with or without a diagnosis.